Hi, my name is Virginia White, and this is my video for the musculoskeletal exam. Hello, sir. My name is Virginia. I'm a nurse practitioner student, and I'm here to do a musculoskeletal exam on you. Your name is Mr. White, is that correct?
Yes.
You have your permission to utilize you for this video.
Yes.
So we will begin by examining the fingers, hands, and we'll move through the different body parts that way. So the first step would be just to examine and inspect your fingers. So if you'll just hold your fingers out for me. Just looking for any abnormalities, looking for symmetry. If you will just turn your hands over and that they appear normal. And then we're just going to palpate down each finger, palpating the joints. There's no redness or swelling of the fingers. And no pain when I palpate.
No.
And then we'll just look for his movement. So I'm going to have you place your hands like this. We're going to put your fingers together, and then we're going to spread your fingers apart, looking for movement, and then back together. I'm going to go ahead and have you curl your fingers in with your thumb, and then back out. Good. So then we're going to move on to the wrists. If you can remove your watch. So same thing. We're going to look at the wrist, looking for symmetry, looking for any redness or swelling. And then we're going to have him do some more range of motion exercises. So I'm going to have you put your hands out straight for me. We're going to move your hands up to the ceiling and then down. And then I'm going to have you put your hands back straight. We're going to go in towards your body and then out. Good. And no pain or anything when you do that.
No.
Then we're just going to palpate the wrists as well. No pain there.
No.
And no pain there.
No.
So we're going to do one more test here. This is called the Tinel's test. I'm going to have you place your hand like this for me. We're going to push it down here. And I'm just going to tap, and you're going to tell me if you have any pain.
No.
And then the last test for the wrist is the Phelan's test. I'll have you place your hands kind of in a reverse praying motion. You're going to put your wrists together. So we'll leave that for 40 to 60 seconds. In the real world, this is what we would do. And then we would have the patient release. You can go ahead. And then they would tell us if they have any pain or tingling down the hands, fingers.
No.
So at this point, we're going to move on to the elbows. Once again, looking for any abnormalities, any swelling, any redness. Same with this. And they appear symmetrical. So we will go ahead and have him do some range of motion exercises. So I'm going to have you straighten your arms out for me. And then we're going to supinate and pronate his hands. So if you'll just turn, and then in, out. And then we're going to have you bend your elbows. So I'm going to go down this way. And then straight, and up, and down. Perfect. And you can relax your arms in. And of course, we're going to palpate the olecranon process on both sides. No pain.
No.
At this point, we're going to move up to the shoulders. So once again, the patient would typically have their shirt off, but for the video, we're going to remain with his shirt on. So looking for symmetry of the shoulders, and they appear symmetrical. And then we would start having him do some range of motion exercises after we inspect the shoulders. So I'm going to have you place your arms kind of at your sides here. And then we're going to go up straight in front of you. And then at this point we would have him do kind of one at a time. And then we would go back behind him. I'm sorry. And the other arm, same thing. Perfect. Now I'm going to have, just check for any rotator cuff injuries. I'm going to have you use this arm, and we're going to go back and scratch your neck. Perfect. And then we're gonna go behind your back and try to touch your opposite scapula. Right here. Perfect. And you can do the other arm. Perfect. So at this point, we would go ahead and palpate. No pain.
No.
And no pain there. So just one kind of specialty test we're going to do is the Hawkins test. Again, checking for any rotator cuff injuries. So I'll have him just kind of relax his arm like this. I'm going to move his arm in towards his center, and he's going to tell me if he's experiencing any pain. You can just relax your arm there. Relax your arm there. Any pain there? Just relax your arm. No pain there.
No.
At this point, we're going to move on to the neck. So just first inspecting for symmetry. And then I'm going to have him do some range of motion exercises. I'm going to have you touch your chin to your chest. And then look back up at the ceiling for me. And you're going to touch your left ear to your shoulder, your right ear to your shoulder. No pain there. Or we could have the patient just do a full head circle if they could. Just all the way around. Perfect. Perfect, that's fine. Then we're just going to palpate the neck. No pain there?
No.
And then at this point, I'm going to just push on the top of his head. This is called the Sperling test, looking for any pain here. No pain?
No.
Perfect. So at this point, we'll move on to the spine. I'll have him stand up for this portion of the test. Just if you could just turn and face that way for me. So we're gonna, first look and inspect for any abnormalities, looking for symmetry of the shoulders, symmetry of the scapulas. Obviously, without the shirt on, we'd be able to inspect a little better. And then I would have him begin with some range of motion exercises. So I'm going to have you, if you can, bend to your right, bend to your left. You can stand up straight. And then try to bend backwards for me. We're just looking for, thank you, and bend forwards for me. Looking for range of motion, making sure that he can move without pain. At this point, I'm going to have you again bend forward for me, and if you'll stay that way, try to touch your toes if you can. So we're looking for iliac crest. That's good enough. That's good enough. You can just stay right there. Iliac crest symmetry, and they are symmetrical. So just feeling the hips, and then we would begin by palpating down the spine. So palpating the actual vertebrae. Checking for any step-offs or pain. And then the paravertebral musculature. No pain there at all?
No.
Okay, you can stand up. At this point, we would go on to to check the hips. So I would have him lie down for this portion. If you could lay down for me. So once again, beginning by inspecting for symmetry. Obviously, the patient would be wearing a gown. Looking for any abnormalities in the skin, and then moving on to some range of motion exercises. So I begin by having you lift this leg with your knee straight up in the air. and then down. So some active and then some passive range of motion. So I'm going to do it for you. And then if you'll do it by yourself. For this one, I would have him turn over on his stomach and do, we're going to have him just lift it backwards so we can see there. So I'm going to do it. And then if you could do it with your knee straight, perfect. It's kind of hard on a hard table, sorry. And then go ahead. Perfect. You can turn back over. And then we'll do some abduction and adduction exercises. So I'm going to have you move your hip away from your body, and then we'll go across your body, and then with this one away from your body, and across your body. Perfect. You can go ahead and sit. I'm going to pause the video just because I have to restart for my time purposes.